In this unit, our focus is the care of clients with problems in nutrition and gastrointestinal function. Now, basic concept. When I talk about metabolism, metabolism is the sum of all body's physical and chemical processes. So this would include both material changes and then energy changes. So when I talk about metabolism, the material changes occurs on the food that we take, and then the chemical changes occur on the conversion of this food to the nutrients that are needed by our body. There are two phases or there are two types of metabolism. So we are talking about anabolism and catabolism. So when I talk about anabolism, this is about building of compounds to use as energy. So when I talk about anabolism, there is build up. In other terms, we refer to this one as biosynthesis. When I talk about catabolism, okay, take note of the word catabolism, there is breakdown of chemicals to release energy. Usually, they refer to this one as a degradative process, okay, or the degradative process. It leads to the degradation of some compounds in such a way that chemicals or energy will be released. If we talk about energy, if you can recall, energy is the capacity to do work. Hence, we need energy for us to order to function. Without energy, we will not be able to carry out the functions, especially that of our cells. Now, there are basic fuel nutrients supplying energy for metabolism. This would include your carbohydrates, your fats, and proteins. Recalling your discussion in nutrition, your carbohydrates, fats, and proteins are referred to as macronutrients. From these macronutrients, it is where the important vitamins, minerals, and chemicals that are needed by our body is derived from. Okay, so take note, that's why they are referred to as the basic fuel nutrients of our body. Now, for metabolism to take place, there is a specific set of processes that is involved in getting the nourishment from food. We could not get everything from our food, and everything from the food could not be used by the body without undergoing these processes. The first one is ingestion. When I say ingestion, remember this is the process of taking in the food through the mouth. Okay, ingestion is basically the act of eating. Next, digestion. In digestion, it is where and when the digestive enzymes and secretions mix with ingested food. So for digestion to occur, there needs to be mechanical and chemical digestion. So it is the acid, it is the enzymes from our saliva and from our stomach that take charge for digestion to occur. Then we have absorption. The main organ of absorption in our GI tract is your small intestine. So this would involve the absorption of your molecules, vitamins, minerals, which are ingested or absorbed, through the small and large intestines. Okay? This absorption would lead to transport through the bloodstream. So once the nutrients or the chemicals or the minerals are absorbed from the small intestines, it would go to the bloodstream for distribution. Okay, and then that is where your cell metabolism would occur. From that substances or minerals or energy which is distributed through the bloodstream, the cell will be able to get the substances that is needed for it to undergo metabolism. Okay, particularly it's using the energy source which is your adenosine triphosphate. Then you have excretion or elimination. In excretion or elimination, it is the process after your digestion and absorption where waste products are evacuated from the body. Okay, again, this is the process wherein the waste products are being evacuated from the body. So excretion, in other terms, is your defecation. Take note of that. Now, the requirements to maintain internal balance. So for us to maintain internal balance, there should be adequate nutrient supply, and then there should be normal functioning of body systems. So we are talking here about two things. There should be supply of nutrient, which is normally from the food that we take, and then there should be functioning of body systems. So one particular system here is your gastrointestinal system. What do I mean by that? A patient who is malnourished may have a problem on food intake due to inadequate supply. However, a patient who is having adequate supply may also have imbalance in nutrition if the patient's gastrointestinal system is not functioning well. Meaning, the patient may be taking adequate amount of food. However, due to the impairment, for example, in the absorption, which may happen in the small intestine, the patient may still not be receiving adequate nutrients. So try to remember there need to be an adequate nutrient supply and the normal functioning of your body system. Now, energy is lost as heat. Remember, the byproduct of energy conversion from one form to another is in the form of heat. Okay? So if your patient is experiencing cold intolerance because your patient could not tolerate the cold temperature, it may be possible that your patient is not undergoing conversion of energy. That's why for your patient who feel cold, usually it is lack of nutrients. Now, adenosine triphosphate. When I say adenosine triphosphate, this is the cells are chemically broken down as ATP, and this is used to perform the necessary function. So adenosine triphosphate came from the cells which are broken down to become ATP, because your ATP serves as the basic source of energy for the cells. When I measure energy, heat is used to measure energy. And that heat is measured through calories or kilocalories. Kilocalories is the metric system for the measurement of the amount of your energy. Now, there are different factors that may be able to determine individual's energy need. One is your basic or basal metabolic rate, or your BMR. So for your BMR, it is 1 kilocal per kilogram of body weight per hour. Okay, this is our basal metabolic rate. 1 kilocalorie per kilogram of body weight per hour. So what do I mean by that? Looking at that simple equation, whenever your patient's weight increases, what do you think happens to the basal metabolic rate? In weight increase, you would expect that the basal metabolic rate would also be increased. Now, factors affecting BMR. For the factors affecting BMR, one is sex. Who would you expect to have a higher BMR? Will it be your male patients or your female patients? Okay, that will be our male patients. Second, body surface area. The higher the body surface area of the patient, the higher the basal metabolic rate is expected. Third, age. When it comes to age and growth, the higher the age of the patient, you would expect that the basal metabolic rate would decrease. In fact, studies have shown that a decrease of 1 to 2% per decade occurs after the age of 20. So there is a decrease of basal metabolic rate. As you might have noticed, usually old people are associated with decreased physical activity. Hence also the decrease on basal metabolic rate. Hormones. One particular hormone, okay, that we might be discussing in the future is that your thyroid hormone. Your thyroid hormone has a major function in the basal metabolic rate. Okay, so the increase of your thyroid hormone, such as in condition hyperthyroidism, found among your patients with goiter, would increase the basal metabolic rate. Then we have nutritional state. For nutritional state, people who are malnourished, patients who are malnourished, tends to have a decreased basal metabolic rate in an attempt of the body to conserve your energy. However, if it is the first days of starvation, there is a tendency for higher basal metabolic rate. So if you have a patient who became malnourished because of starvation, on the first days of starvation, the basal metabolic rate tend to be increased, okay, in the attempt of the body to provide the energy needed by the cells. Now, body temperature and environmental temperature. Higher body temperature or higher environmental temperature also tends to increase the basal metabolic rate. Okay, diseases that increases cellular activity. So if you have diseases that would increase cellular activity, that would lead to increased basal metabolic rate also. Increase in muscular activity would also lead to an increase in your basal metabolic rate. Activity level. Once the activity level of our patient is increased, you would expect that there will be an increase in the energy needs. Hence, there will also be an increase on the basal metabolic rate of the patient. So if we are talking about patients who have been engaged in athletics, who have been engaged in gym activities, so you would expect that the basal metabolic rate of these patients are increased. Then energy for food digestion. Increase in your food intake would increase also your energy expenditure and would also increase your heat production. Because again, remember, when we are digesting food, it would lead to the process of metabolism. And when these processes are activated, okay, there is conversion of energy from one form to another, hence heat production. With regard to the energy expenditure is brought about by the need to digest the food that you have taken. That's why oftentimes, if you have had sudden food intake, the tendency of these patients is to complain of shortness of breathing. That is because of the increase in the energy expenditure that you are experiencing. Then, other factors affecting energy needs. One is heredity. Okay? There are hereditary components or genetic components which shows that obesity is a hereditary factor, has a hereditary factor. There are also patients who have a tendency to have higher rate of catabolism compared to other patients. Then we have your set point theory. According to the set point theory, there is a set point when it comes to our body weight. Okay? They say that the body weight is regulated at a predetermined or preferred level by a feedback control mechanism. Okay? This theory posits or proposes that there is a set point for our weight, and then the chemicals in our body would try to maintain this set point through feedback control mechanism. Then you have your appetite, and then you also have your environmental influences. As mentioned, a hotter environment would lead to higher need for energy. Now, you might be wondering if how does the food that we take meet the body's metabolic needs? Okay, basically, our body would try to break down the nutrients, which are considered to be complex organic compounds, into simpler forms. And this breaking down is accomplished again by mechanical or chemical processes. For example, if you are dealing with starch, what do you think is the enzyme that would be able to break down starch? So you have your amylase. If we are dealing with lipids, we are dealing with fats, what enzyme will be able to break down the fats? That will be your lipase. And then in the metabolism of protein, one particular enzyme that our body uses is trypsin. Okay, so try to remember your amylase, your lipase, and your trypsin. These are some of the enzymes that helps break down a complex molecule to a simple molecule for us to be used by our body. Complex compounds, I mean to simple molecules. Now, what are the physiologic functions performed by your CHO, CHON, and then your fats? So basically, it would furnish energy that is needed by our body. It would also provide components for cell growth and maintenance. Remember, cell maintenance and cell repair is taken care of by your protein. And then supply material for the compound that regulates the body function. Remember, our body will not be able to function without glucose. Picture a patient with hypoglycemia. They would usually become weak. Okay, they would usually have impaired thinking compared to your patients who have normal levels, of glucose. Now, the gastrointestinal system. If I talk about the gastrointestinal system, that's the system from your mouth going towards your esophagus, going towards your stomach, and then you have your small intestine, your large intestine, and then your anus. A 23 to 26 foot long system, which is 7 meter to 7.9 meter in metric system. Okay, the longest part of which is your small intestine. So this is the system that takes charge of our digestion, the same system that takes charge of our nutrient processing. Now, for this system to be innervated, you have your sympathetic and then your parasympathetic effects. So when I talk about sympathetic and parasympathetic effects, okay, these are parts of your autonomic nervous system. Now, let's try to recall the effect of sympathetic nervous system to our body. Remember that your sympathetic nervous system is your fight or flight response. Okay, if you can recall our discussion, sympathetic nervous system would mean that everything is up except for GI. Meaning the effect of sympathetic, once the sympathetic system is innervated or stimulated, it would inhibit the action of your gastrointestinal tract. By inhibiting the action of gastrointestinal tract, what does it do to peristalsis? Does it increase or decrease peristalsis? You would expect peristalsis to be decreased. With that decrease in peristalsis, what would more likely happen to your patient? Will there be constipation or diarrhea? The likelihood is that the patient will have constipation. Okay? If you can recall, when I talk about sympathetic nervous system innervation, this talks about dry. Okay? The reactions tend to be dry. Okay? That is if we compare sympa as dry and parasympa as wet. Okay? So what do you think will happen to the gastric secretions in sympathetic response? What do you think will happen to the number of bowel sounds that you will be hearing to the patient or from the patient if there is sympathetic response? What will happen to the peristaltic movements? And what will happen to the amount of GI output? You try to answer these questions for both sympathetic and parasympathetic nervous system. Next, primary functions of your GI system. There will be breakdown of food particles into molecular form for digestion to occur. Then, there will be absorption into the bloodstream of the small nutrient molecules which are produced by digestion. The absorption, take note, the main organ of absorption is your small intestines. That's why if we have patients with problems in the small intestine, we would usually have problems leading to malnutrition because a lot of nutrients and chemicals, molecules needed by our body is absorbed through the small intestine. Next, elimination. So take note, what is being eliminated is undigested, unabsorbed food stuff and other waste products. We have your stomach. Your stomach is the one that stores, secretes digestive juices, and propels the chyme. Okay, so your chyme, when I talk about chyme, it is a partially digested food mixed with gastric secretions. So your chyme, once it progresses towards your gastrointestinal tract, would become your stool or feces later on. Okay, so again, stomach stores, secretes digestive juices. And these digestive juices ought to be, are they acidic or alkaline? It's supposed to be acidic. Okay, and this acidic environment helps in the digestion of our food intake. Now, your stomach is divided into several anatomic regions. One is your cardia. Your cardia is the narrow portion of your stomach. Then you have your fundus, which is the upper portion of your stomach. The body of your stomach is referred to as your corpus that acts as the main storage area. And then you have your pylorus, which is the distal portion of your stomach, also referred to as your antrum. Okay, so if your cardia is the entrance, your pylorus is the outlet. That is why there is what you call your pyloric sphincter. If you can notice, the pyloric sphincter is surrounded by your circular smooth muscles. So this one is your pyloric sphincter, this one is your cardiac sphincter here. Okay, so you have your pyloric sphincter and your cardiac sphincter on the upper portion. Your cardiac sphincter is also known as your lower esophageal sphincter. As a sphincter, they close and open for the purposes of having the movement of your food. One important cell that is being contained in our stomach is referred to as your parietal cells. These parietal cells are the cells which are in charge with the secretion of your hydrochloric acid. And if you can recall, your stomach is considered to be acidic in nature with a pH of 1 to 2. And then the fluids produced by our stomach could amount to up to 2.4 liters in a day. Also, it is the same parietal cells that produces the intrinsic factor. What is the relevance of this intrinsic factor? Your intrinsic factor is a substance that combines with vitamin B12 so that it can be absorbed by our body. Okay? Which means that if I will have a problem with the lining of my stomach and then the parietal cells are destroyed, my patient's intrinsic factor would be decreased. And then the patient will not be able to absorb vitamin B12. What then is the relevance of your vitamin B12? Or if your patient lacks vitamin B12, what do you call the condition that results due to the lack of vitamin B12? Okay, try to answer these questions. Also think if your patient would undergo gastrectomy. When I say gastrectomy, there will be removal of your stomach. What could possibly happen to the vitamin B12 of your patient? And what are the signs and symptoms associated with this kind of anemia? Okay, try to answer those questions. Now, the next part is your small intestine. As previously mentioned, it is considered to be the longest segment. There are 3 sections for your small intestine. So you have your duodenum, your jejunum, and then you also have your ileum. So your jejunum is considered to be the part of your small intestine where most of the absorption takes place. That's why if ever there will be a problem with jejunum, we will have problem with the nutrients received and absorbed by our body because that is where most of the absorption would take place. Now take note of the order there, duodenum, jejunum, and ileum. Because if ever you will be having problems in your stomach and the partial gastrectomy is done, there is a possibility that the portion of the stomach would be connected to your duodenum. Also a possibility that a portion of your stomach will be connected directly to your jejunum. Okay, we will learn about these surgeries as we go along. Our small intestine terminates in what we refer to as your ileocecal valve. It's referred to as ileocecal because if you can recall, ileum is the distal end of your small intestine, and then cecal referring to the cecum, okay, or the term that refers to your colon or your large intestine. Hence the term ileocecal valve. And then your ileocecal valve is the one that prevents the reflux of your chyme, or your chyme, I mean, okay, from the large intestine towards the small intestine. Because remember, after your small intestine, it will be the ascending colon. Hence, without the ileocecal valve, there is a tendency for your stool, okay, or your chyme materials to go back to your small intestine. That's why it's referred to as a valve. Now, villi. When I talk about villi, these are small finger-like projections that produce enzymes and absorb nutrients. So the one in the picture in the background of this slide are your villi. Okay, so these finger-like projections are the ones that absorb the nutrients that would be brought towards our blood vessels, or our blood for distribution towards the body. Now, so this is your small intestine. Let's talk about your large intestine. So your large intestine extends from your ileocecal valve towards your anus. So it is consists of your ascending colon, transverse colon, and then you have your descending colon. So it is the terminal end of which is completed by your sigmoid colon, and then you have your rectum and then your anus. So try to familiarize yourselves with the location of this, because for example, if the doctor will say sigmoidoscopy, that would include visualization of your sigmoid colon. Okay? If the doctor would say anoscopy, that will be only including the visualization of your anus. If the doctor will be saying colonoscopy, that would include visualization of your colon. Okay? So, now, what is the main function of your large intestine? Our large intestine functions to absorb water and electrolytes. That's why if there will be cancer on the large intestine and then this part of the body would be removed, one of the problems that we would have is dehydration. Because if you can notice, if you can recall, the secreta or the excretion, I mean, from the small intestine is still watery compared to that in the large intestine. If I am going to compare the secretions or the excreta from the ascending colon, transverse colon, and then the descending colon, the waste products that would come from the ascending colon will be more watery compared to that of the descending colon. Because water absorption takes place as long as or during the time that your chyme or your waste products are traveling from your ascending colon towards your descending colon. So, if your patient would have a colostomy on the ascending colon, the tendency is for this colostomy to have watery substances. Hence, your patient is at risk for water, fluid volume deficit, and then electrolyte imbalances. Now, bacteria. Your gastrointestinal tract is not considered to be sterile. Your gastrointestinal tract, especially your intestine, contains bacteria. One of the purpose of the bacteria in pediatrics is that it produces your vitamin K, which would be helpful on the clotting activity of our body. In the adult, okay, the bacteria also is the one that completes, are also the one which complete the breakdown of your waste material. Then we also have mucus. Your large intestine is lined with mucus, and this mucus protects the colonic mucosa and provide adherence for fecal mass. Now, going back to the bacteria, that's why if we are going to operate a patient on a gastrointestinal surgery that would involve the large intestine or the small intestine, the tendency is for the doctor to give antibiotics before the surgery for this bacteria, this normal resident bacteria, to be cleared before the surgery. Because if this bacteria would be scattered throughout the body, the patient may become septic. Then we have your metabolic process. So a recap. So we have ingestion. This is the act of eating. So remember, your ingestion is triggered by hunger, appetite, and satiety. So take note that the center of satiety is your hypothalamus. Okay, the center of temperature, even the center of satiety is your hypothalamus. So as I mentioned earlier, ingestion is the act of taking food through mouth. Digestion takes place in mechanical. There is mechanical digestion when I talk about peristalsis. Your chemical digestion happens when we talk about the enzymes of the body. Then we have your absorption. Okay? Your absorption usually takes place in the first and second intestinal segments. nutrients, okay? And that will be on your duodenum and jejunum. And when I say absorption, again, this is the process wherein the nutrients enter the bloodstream through the intestinal wall. And specifically, that would be the finger-like projections that we talk about, which is your villi. There are several mechanisms for absorption to occur. One is simple diffusion. When I say diffusion, it is the movement of your nutrients. Okay? It is the absorption from an area of high concentration to an area of low concentration. When I talk about carrier facilitated diffusion, this is considered to be a spontaneous passive transport of molecule via a membrane of proteins. Okay, so it is carrier facilitated, and the one that acts there as a carrier is your membrane of proteins. Then we have active transport. When I say active transport, obviously there will be a use of energy for this transport. And then we have another term, which is your pinocytosis. For your pinocytosis, it is where a certain type of cell would take in the substance and then have this substance transported to other part of the body. In that case, that will be from the surface of the small intestine to the bloodstream. So, pinocytosis. Now, we have fat and fat-soluble vitamins. So, your fat and fat-soluble vitamins are absorbed as mixed micellase. Okay? This mixed micellase would enter your small intestine. When I talk about micellase, your micellase are considered to be polymeric molecules. So, these polymeric molecules may have your hydrophobic and your hydrophilic ends. We also have the term chylomicrons. When I say chylomicrons, these are lipid droplets which contain mostly triglycerides. These chylomicron of yours are the one that transport dietary lipids from the intestine to other locations in the body. So your chylomicrons is the one that facilitate the absorption of fat and fat-soluble vitamins. If you can recall, the fat-soluble vitamins are your vitamins A, D, E, and K. Then, we have water, alcohol, minerals, and glucose. Okay? Some of these amounts of glucose are being absorbed in the stomach, whereas water, indigestible food parts, and some vitamins and minerals are being addressed in the colon. Okay? When I say colon, that usually refers to your large intestine. Then, water-soluble nutrients are dissolved in the plasma and would enter your portal vein. From the portal vein, it would go towards your liver where it will be processed and metabolized. And then your fat-soluble vitamins would enter your lymphatic system as chylomicrons. And then it would go towards your left subclavian vein, going to your heart, and then later on going towards your liver. So that's how your fat-soluble vitamins would work. Now, transport. So we've talked about ingestion, digestion, and then absorption. The next part of the process is your transport. So this transport occur, okay, once the substance have been absorbed from your small intestine, it is being absorbed towards our bloodstream, it passes through the liver. From the liver, it is being metabolized, or it could be directly transported to the body cells. And then it could go towards the interstitial fluid through your arteries and your capillaries. And it is where it will be transported across your cell membranes. Once these nutrients and energy are inside our cells, that is where it is being utilized for cell metabolism. Okay, so cell metabolism, it is the physical and chemical changes that occur within the body cells with the expenditure of energy. Then, we have your excretion. After the cells have made use of these substances, and after these substances, or some of which are absorbed through our small intestine, okay, it would undergo excretion. So it is the final nutrient use phase, done through the large intestine, if we're talking about the fiber components, done through the kidney, the lungs, and the skin, if we're talking about the metabolites. So, your excretion would include the undigested food residue, the metabolic waste, and then the dietary excesses that our body has. Okay? One example would be your vitamin C. If you can notice, if you're taking a lot of vitamin C, the excess of the vitamin C would go out through your urine. Now, excess of carbohydrates, protein, fats, and fat-soluble vitamins are not excreted but mainly stored as adipose tissues. And when I say adipose tissue, it's referring to your fats. So that's why excessive intake of these macronutrients could possibly lead to obesity. Okay, now the next slides will be talking about the nursing process and assessment of the patient of gastrointestinal system. So kindly watch out for the next recorded lecture. Thank you very much for your kind attention on this one.